Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. At least 3 human avian flu cases have been reported since 2024 among people in the United States who own backyard birds. Today, we'll be going over what's important to know if you keep birds in your backyard with Dr. Elizabeth Asiago-Reddy. She's Upstate's Chief of Infectious Disease. Welcome back to The Informed Patient, Dr. Asiago-Reddy.
That's great to be here, Amber. Thank you.
When we talk about backyard flocks, is it mostly chickens we're talking about?
Yes, the vast majority of people who have backyard flocks have chickens. There was a survey done by the CDC, and it was a voluntary survey. So they could have missed people who didn't participate. But of those who did respond, 97% of them had chickens, but about 20% of them had other birds aside from chickens, which were mostly ducks and geese.
And are these being kept as food sources for eggs, or are they pets, or both?
It looks like it's usually both. So most people who have backyard flocks do collect and eat the eggs, but they often also cite the companionship and getting to know the chickens in the process. And they oftentimes do consider them to be like pets. It's a little bit less common for people to use backyard flocks for food from a meat source perspective.
Well, let's talk about avian influenza then. How concerned do we need to be about it?
It's definitely something that our public health entities have had on their radar screen for really the past 20 years in particular. And the reason for that has been that we've seen multiple cases in humans throughout those years, and many times they have been severe. And the other reason is that we've seen the virus, the type of flu virus that causes avian influenza, spread into other types of animals. And once you have a larger reservoir for the virus, there's a higher likelihood that the virus could undergo changes that would allow it to spread more quickly or more easily to humans. And most concerningly would be spreading between humans. So right now, this is a virus that we've seen that on fairly rare occasions will jump from animals to people. But what it has almost never done is jump from people to people. And that's where we really get worried and run into problems.
What symptoms does it cause in birds themselves?
So there are 2 different categories of birds when it comes to thinking about avian influenza. There are the wild birds, which primarily we're talking about when it comes to carriers of avian influenza. We're talking about migrating wild birds, such as geese and also gulls. But those animals are well adapted to the virus. So oftentimes they don't exhibit any signs of infection, and the virus just kind of circulates within their communities. The problem is that then those wild birds move from place to place. And if they come in contact with particularly poultry, especially chickens, but some other kinds of domesticated birds as well, then by sharing water resources, by getting the droppings into water or food, or even just close, intimate contact between those birds, if they're, just next to each other, then it can spread the avian influenza from the wild birds into the domesticated birds. And the domesticated birds do not have such an adapted immune response, so they can become very, very sick.
Are the eggs from the infected birds dangerous to eat?
What happens with the birds who do become sick is that oftentimes they get ill so rapidly that it shuts down their egg laying system completely. So it's actually quite rare for the virus to be involved in the eggs at all. But if that were to happen, then cooking the eggs would eliminate the virus. So it shouldn't pose a danger as long as the eggs are not eaten raw.
Is there any way to treat we'll say chickens if they do become infected, or is this sort of a lost cause once they have bird flu?
It it unfortunately is a lost cause. And even though it's possible for some domesticated birds, some chickens to recover, most of them or many of them do not recover. And they also shed virus for long periods of time. So once one bird has gotten sick, it is a situation where the whole flock is eventually going to become infected. And then there's more of a concern of that infection passing on to other animals or possibly to people. So it's still a recommendation that unfortunately, if one member of a flock is diagnosed as having this, then the whole flock should be sacrificed.
I've read about that in news accounts when this has happened. So if we're talking about other animals, and we'll get to people next, but are we talking about cows, pigs, cats, dogs, whatever might be around the chickens?
So of the ones you've mentioned, three of them have been identified as intermediate hosts of the avian influenza, and that includes cats, you mentioned cows, and you mentioned pigs. So cats are not a real major concern in terms of the spread of the virus. It seems that incidents involving cats are very isolated and, happen to be in situations where people have a cat in a backyard flock, that type of thing. But when it comes to livestock, it is definitely a more concerning situation. And typically, our concerns have revolved around pigs. And there's a couple reasons for that. One is that many of the avian influenza viruses are common in Asian countries, and the farming practices there, as well as food selling practices, often put pigs and chickens in very close proximity to each other. So, a lot of opportunity to pass viruses back and forth. But the other reason is that pigs actually are able to carry both human flu viruses and bird flu viruses in their trachea, which is their windpipe. And so, if the two viruses are in the same location like that, that's where the likelihood of those viruses mixing their genetics and resulting in something that has a new capacity to either cause infection or propagate or be more severe could occur. Many of us remember swine flu. And that was a situation where something like that appeared to occur, and that's resulted in a strain that spread widely. In terms of severity overall, it turned out to be not extremely severe, but it was severe enough that when you have a very large population of people that are exposed, that becomes a very significant public health event, even though relatively few people percentage wise experience severe symptoms. So pigs are definitely a concern. And then cows is a relatively new phenomenon that we started to see really in 2024 in the US with large herds of cattle becoming infected. And that also appears to be just from shared water and food sources. So if feeding troughs or water are populated by the same animals, then this can spread from one group of animals to another. The cows, interestingly, overall have experienced different type and somewhat milder disease than birds. So cows really, what we discovered is that the main receptor on the cells of the cows that is likely to become infected with this virus is in their udder. And so they tend not to get a respiratory infection, and instead they get what's called mastitis, which is an inflammation of their udder. And so they do tend to recover, but they need to be removed from milk production if this happens and isolated from other cows so that they can recover. So it remains a significant economic and practical problem for dairy farmers for this to happen. But in terms of loss of an entire herd of cattle, it's not as devastating as it is when you start to lose chickens.
And there's no way to inoculate these animals to protect them ahead of time from getting bird flu.
Though, I mean, those are things that are worked on. The challenge is that just like we see with the human flu virus, this virus is dynamic and changing frequently. And so it's difficult to keep on top of getting a vaccine that would be offering adequate protection.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking about avian influenza with Dr. Elizabeth Asiago-Reddy, the Chief of Infectious Disease at Upstate. What symptoms might it cause in a human? How would you know that you might have bird flu?
All of the typical flu-like symptoms are possible here. So that includes fever, cough, nasal congestion, fatigue, aching muscles, but also you can have red eyes, which is conjunctivitis, and you may have some gastrointestinal symptoms like nausea, vomiting, or diarrhea. So all of those could be seen with your typical human strains of flu that have been circulating. But the conjunctivitis is a little bit unique, and that has been seen most frequently in people who have been exposed through contact with dairy cattle.
And is it true? I think the CDC has reported, 3 cases, but 2 of those were deaths from bird flu. Is that right?
So 3 cases that have happened from exposure to backyard flocks. So there's been, since 2024 in the US, there's been 71 cases overall, but 3 of them came specifically from backyard flocks, and 2 of the deaths came from backyard flocks. That did prompt an effort in the US to try and better understand. That's where the origin of this survey was, to try and understand among people who have backyard flocks, what is their knowledge about avian influenza, and is there anything that could be done to help prevent something like that happening again, where people actually die after exposure. So part of the reason we think that there's such a discrepancy, we see the 71 cases and people who have been exposed outside of the context of backyard flocks, where 2 of 3 dying within the context of backyard flocks. None of the others were fatal, except this one that was of an unknown source, actually. The reason is that people who are being exposed as part of their livelihood are typically and should be educated about protective equipment. So dairy farmers who are working in situations where there's knowledge that something like this might be happening, they're instructed to wear personal protective equipment. And then similarly, people who work in slaughterhouses and the like for chicken, they also need to be wearing personal protective equipment as part of their job. So if they get sick, they probably have a very limited exposure to the virus because of maybe a lapse in personal protective equipment that could be different from somebody who maybe has a backyard flock and doesn't understand what's going on, and maybe is like even holding or hugging their chicken with no protective equipment at all.
Well, that's what I was thinking of. If many people think of these as their pets, I mean, what do you recommend that personal protective equipment? Are we talking about a face mask or goggles, or how extensive does the backyard chicken person have to be?
So the biggest thing with the backyard chickens in terms of personal protective equipment is if you notice that one of them appears ill. So if you see signs of illness, even if they appear to be mild, maybe you notice a chicken seems listless, not eating as much, even diarrhea, rapid breathing, anything like that, or certainly if one dies unexpectedly, then you actually would want to use as much personal protective equipment. So we're talking really head to toe coverage to work with either the deceased animal or sick animal, and until you understand what's going on. If you're not able to access, so this would be things like putting a head covering on, goggles, a full jumpsuit, disposable gloves, and boots. If you don't think that's feasible or you feel nervous about how to do that, there is information on CDC websites about how to do that, including, where you can purchase items of personal protective equipment. But you can also just contact either your local vet or the health department if you have concerns, and they can assist as well. So you could avoid contact with the flock while you're trying to figure out what's going on. That would be another possibility that would enhance your safety as well. In terms of regular interactions, when you don't notice that the animals are sick, people with a healthy immune system, it's really just making sure that you practice hand hygiene after working with animals or their feed. So washing your hands after any contact with the flock. And if you are cleaning out the enclosure, then it's very reasonable to wear a mask in that process. Just because even it could help to reduce irritation from engaging with cleaning and feathers, et cetera. But if someone is immunocompromised and they've been told they're immunocompromised, then it is probably more ideal for someone else to be engaging, in particular with cleaning of the chicken enclosure. But even on a more regular basis, it could be recommended to wear a mask or gloves, just depending on what your healthcare provider advises.
Are the neighbors who live on either side of a house that has backyard chickens, do they have any concerns just from being nearby?
They shouldn't have any concerns because it really would be much more direct contact with the animals that would result in an infection.
Now, does any of this advice apply to people who keep bird feeders or bird baths in their backyard and they don't have chickens, but they enjoy inviting wild birds into their yard? Do they have any concerns?
Very minimal. For the most part, avian influenza does not appear to infect most of the types of birds that visit typical kinds of bird feeders, songbirds. There have been documentation of some rare and limited circumstances where that has not been the case. That's been in Asia, where they've found some cases of songbirds being infected by a less common type of avian influenza. That's an H7N9, so it's a kind of a different strain than what we're typically seeing. But this is unusual. It's rare. It doesn't appear to happen with any kind of regularity. The one thing to keep in mind, though, is that the U.S. Centers for Disease Control recommends against people who have backyard flocks also having a bird feeder. And the reason for that is that the way that backyard flocks get avian influenza is when other types of birds are in contact with them, right? So even though typically we are putting up a bird feeder because we want to see cardinals and we want to see other types of pretty backyard birds, right? Still, different migratory birds could just as well be interested in going to the feeder as well, right? I mean, I think all of us are seeing a lot of geese absolutely everywhere, right? So geese could go to the feeder, other types of migratory waterfowl could go to the feeder, and then those ones could interact with your backyard flock. So in order to keep your backyard flocks safe, it is recommended to avoid putting a regular bird feeder out. And also another safety measure, if possible, is to keep their food and water in a protected location. So that would avoid other types of birds accessing the food and water from your backyard flock. And that really is one of the main ways to keep them safe.
Now, what about people who have caged birds that live indoors? Is it safe for them to set the cage outside and let the bird enjoy some of the fresh air?
Yes, as long as that's an enclosed cage, then it's totally fine. So you wouldn't anticipate that a waterfowl would be able to get in there and access the bird. That should be completely fine.
Now, at the beginning of the conversation, I think you said that health experts started looking at this like 20 years ago, bird flu being an issue. Is this with us for the foreseeable future, or will this kind of end at some point?
It's definitely with us for the foreseeable future because now that we've recognized it, and it's not to say that it wasn't there, it's just that we started to recognize it more. So now that we've recognized it, it's clear that there are large populations of migratory waterfowl that are carriers of avian influenza. And so it's really not feasible to get those birds completely under control, nor would it really be necessarily recommended from an ecosystem perspective. What is challenging is just our further and further erosion of wild spaces so that there are more and more animals coming in contact with one another that might not have otherwise come into contact with one another. So that's where we're running into more problems, is just the concentration of contacts between different types of species of animals that may not have been in as much contact before, and that further contact with humans. So that's where we really have to keep our monitoring up and keep our research up. And there are ongoing research activities all the time trying to be ready to prepare a vaccine in case there were to be a spillover of avian influenza into the human population.
Well, this is very important information, and I thank you so much for making time to tell us about bird flu.
Absolutely. Thank you so much for having me.
My guest has been Dr. Elizabeth Asiago-Reddy, Upstate's Chief of Infectious Disease. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.